My dearest, darling daughter. My dearest, darling daughter. Oh, Lynne, how deeply meaningful and precious many years ago you started your notes, your cards, texts, and emails with my dearest mother, and I responded immediately with my dearest, darling daughter. I want you to know I spend time reflecting on all that you were in this world, in sports, your sense of composure. When your shot trailed off course, you calmly stated, "I'll get the next one."
Mental illness doesn't really have, any visible physical manifestations. If someone is skilled at hiding symptoms and if they're able to, perform in their job and in their life at a high level, it's really hard for people to detect, the pain that might be underneath.
Life before guilt becoming part of our world was chaotic. We had hope, and then it crashed, and then we'd resurface again and try doctors, psychiatrists, but they didn't help.
Many of our clients, they might have experienced the stigma of mental illness, so we show up and treat people like humans and give them the respect they deserve.
Our first introduction to guilt was when Lynne had a severe and intense breakdown. You were assigned a case manager and a team of mental health professionals. A psychiatrist listened to you, guided you, and began to design a treatment plan specifically targeting your mental health needs. We were empowered with hope, steady hope.
In case management, we coordinate healthcare. We connect people to different financial benefits, help them maintain their housing. We try to be a hub for getting a team together to support somebody.
What that meant as a mother, guilt brought life back into our lives after years of struggle and trying to make sense of Lynne's world. They helped by taking on our burden.
The ACT teams, Assertive Community Treatment at Guild, are groups of clinicians, multidisciplinary groups that work with people who have severe and persistent mental illness. And it's really a method of treatment that's been developed to work with people who don't do well in traditional clinical settings.
What was different with Guild was that everyone was consistent, dependable, and the way that they spoke, they were talking about the mental illness, but they were also addressing Lynne as an individual. Once Guild was involved, Lynne's life changed dramatically. She felt able to communicate, to function, to have hope, and began to live independently with the treatment plan of monitoring Lynne, keeping an eye on her, and being available to her and for her. Even after you were stabilized, Guild was present, always as a resource, always under the waterline, if and when required. And that time came. In 2025, she was struggling, and I was lost as to how to help her. Doctors disregarded you, deaf to your requests. And I said, "Lynne, how about let's call Guild?" Immediately, she said, "Let's do it."
Really spending the time to get to know someone, to understand where they're starting from, what they're open to at this point, and partnering with them from there. It often takes patience, it takes time, but the progress is more sustainable.
On Saturday, May 10th, remember I inadvertently opened a package, left at my front door a gift from you. I called immediately to apologize, and you firmly stated, "Mother, I wanted you to have it today. It's beautiful, and it even has a heart next to the A for your name." And recall I said, "Please call me when you tuck yourself in bed. Please call me." On Mother's Day, the 11th, I found you resting peacefully, my heart racing, knowing that which I didn't want to know. Please wake up, my dearest darling daughter. May 2025, your angels carried you.
I think it's important for families to know that they're not alone. That would be the primary thing I'd want them to feel the moment we step in, that there's someone else that can help support.
When I think about legacy and Lynne's legacy, I think about a beautiful, inspired young woman who had dreams, and even through the mental illness, she was composed and had a life full of love. Deeper still. Thank you, Guild. My dearest darling daughter, Lynne, I am grateful you are and will be. Me and you forever, my daughter. And Lynne, you are loved and you are missed.